and sit and meditate, depending, whatever kind of meditation they follow. So some people would sit and just hear. See how quiet this place is? People can sit and meditate. The window is almost like it's a window actually from a Christian church.
Oh, really?
But it actually is, if you would also see, it's in a form of a mandala. So it's an interesting crossover between Christian symbolism and mandalas as being universal. We have places where people can come and meditate or pray. Most patients can't get out of their rooms. I mean, most patients are being treated. It's families who come here. Some patients will be brought down by their nurses, like Sunday services or whatever important to them. But mostly our contact is through the things are televised.
I'm there, okay, I talk to them about breathing and what I'm actually doing. I don't name meditation, but I'm guiding them through a kind of meditation. And what we do, I would give them my fingers. I say just 2 fingers. They can hold on to it. They can squeeze as much as they do, because when people are in pain, they tighten up, okay? So you're there. They tighten up on you, but they can't hurt you if you give them only 2 fingers, but they can squeeze as hard as they want. But at the same time, you talk to them calmly. You say, you're going to breathe in, you're going to breathe out, because this helps with the pain. Because what you're doing is, if your mind in meditation is not cluttered with all these thoughts, and not cluttered with these, I am hurting here, I am hurting there, this is too much, I can't bear this, all of these, I want this to stop, all of these thoughts. If I can talk with them so that they're actually meditating, and this is a guided meditation rather than the nice, serene, sit for 45 minutes and breathe in, breathe out. I do with the Buddhist meditation, Zen meditation, which is concentrated on, you concentrate on your breath. And if you have thoughts, when you're just doing more formal meditation, just acknowledge them and go back to counting your breaths, in and out. So I will be doing assisted meditation with someone who is in pain, especially say in an emergency situation. Breathe in, breathe out. Think of yourself, breathe in, breathe out. And I can distract sometimes, and that'll alleviate the pain for a while and help. After something like surgery, or, I mean, you can't, with narcotics, whatever, you're not going to dull all of this, because the pain, you don't want too much narcotic in anybody, you don't want too much painkiller in people, especially as they come back. So I will say, we teach you breathing, and I don't call it meditation because that sounds too formal to me. I say, when the pain comes, what you do, breathe in, hold it, and breathe out, and count when you breathe out. And see if you can get to 5. Don't get to 5, start all over again. What you're doing in relationship to pain is breaking the thinking about pain, and going, if you do it enough, you can go into a state where it's not as prevalent. Now, mental suffering, thinking this, that, borrowing the future, I call it, I don't know, these terms, mental suffering. Now, what's happening right now? Especially people who've been a skier and broken their leg or their hip and will never be able to ski the same again, or people whose lives have changed because of something. You'll say, I won't be able to do this, or I won't be able to do that, or I'll say, okay, right here now, what's in front of you now? Oh, I'm breathing, I'm alive. Oh, my mother's coming to see me, I'm loved. I see distracted. Okay. The meditation part, see the breathing part that will help you stay where you are. I do the same thing. I talk about breathing in, breathing out, and bringing your mind back to the room. Even if you can't see any further than your toes. If you've ever been very ill, you'll find out as you get better, the room gets bigger. You can be more and more aware. So you say, okay, what do you have right now? So you say, okay, just breathe in, breathe out. Once you start thinking something that's going to cause pain, suffering, pain, say, bring yourself back to what it is. Or if you're reliving the accident, just let it play out. Come back to where you are. Come back to the good pieces that are. If you're grieving because somebody died in an accident, you say, yes, that is very, very sad. Yes, that's horrible. Acknowledge it. So that's another kind of meditation with a different kind of pain. Okay.
So, do you have any sort of method that's different, based on different accidents?
No, actually I don't. That's interesting. That's a very interesting question. I can't judge the kind of pain, or I think because it varies from people, like that. Like some people, when you're going to do your tattooing, some people couldn't care less, as long as they don't look at it, they're fine. Other people, they're fine if they look at it. It's like their pain thresholds are different, so I don't know. But the meditation, where you're talking about meditation, you're talking about, I think, something that would be bringing people into the presence, but focusing on part of their body, their breath, using their brain, occupying their brain, because you don't think so many things at once. The breathing and the counting and the being aware, so that they're less aware of the cause of the pain. So no, I don't. In practice, I don't have anything different, and I don't use it with everybody.
So do you think that every patient felt better after, like they felt the same sort, like the same level of I don't know.
Like it's hard to tell with physical pain, because once they're diagnosed, they'll be able to get different kind of medications, and some of them will be able to. It's on demand, like they can't do it constantly, but if they're in pain, like every 10 minutes, they're allowed to, but they might be able to go for 15 minutes without being pain. They control this themselves. There's a distance kind of thing, and that's what we do. But I know that it helps with the mental pain, because I can see people who are here for a long time. And I know that bringing yourself back to the present and not worrying about past, not worrying about future, planning, yes, being sensible, of course. You never get your phone with everything planned. but dwelling on it and worrying about it such that you create very fast breath and stuff like that, or tighten your muscles. If you tighten your muscles, you increase pain. So one of the things with the meditation and the breathing is the relaxing of the muscles. So relaxing, so it's coming less pain. So I don't have anything to, I just don't have that kind of research at all.
Okay, it's okay. I just want to ask, like, could you tell me how a patient will get this kind of treatment? Like, how many times they will get this sort of treatment?
It's not a treatment that we do formally. We do Reiki. People can regress Reiki, which is kind of moving of energy, moving the chi through the body. But meditation, we don't offer. So I don't have any kind of basis for that. It's something that I do growing out of my belief system that I do, and I carry the pager for the trauma a couple times a week. And it's something that I do. Other people, say from a Christian thing, area, might talk about prayer and praying. And for some people, prayer is meditation also. There is, are you familiar? Are you Christian? Are you familiar with Christian? You're familiar with Christian theology?
I always love Christian myself.
Okay, so there's part of Christian theology, and it's from the First Covenant, which is sometimes called the Old Testament, and it's a psalm, and it's written by King David, like, I don't know how many years ago, something years, but it's a poem, and he had a very unsettling life, and he was a king. But there's one of the verses that people use, it's called "Be still and know that I am God," and people use that as a basis for Christian meditation. So for Christians, there's prayer of praise and worship. There's prayer of petition, please do this. Okay, but there's also the quiet prayer, which can be equated to a kind of meditation, which is being still and just trying to, and maybe focusing, maybe with your eyes open, focusing on a picture, focusing on a Bible verse, which is a receiving kind of prayer, and that's kind of the basis for Christian meditation. People might be doing that on their own. You know, people will say, okay, because as chaplains, we hardly ever say to somebody, calm down. You never say that. That is like, it's like, oh no. What you say is you go for the symptoms. You say, okay, breathe easily. We're going to pray now. We're going to wait upon God. Let's sit in silence, and just counting your breath. And so I might use different words with a Christian, than I would with someone I have no idea, kind of thing. But same kind of effect. So it's not tied to a particular faith tradition, but in my case, it's tied to a particular practice, because I am Zen, and the whole thing with Zen is meditation, sitting quietly, either sitting or walking or just before you go into the room. That's called centering. Okay. So some of it's going to grow out of my particular view of God's universe. But unfortunately, we do not have that kind of research or program here of, okay, we're going to expose everyone to meditating in order to relax or something like that. It just doesn't exist here. We provide a place, we provide a space. This is the Cancer Center, and I know eventually they would like to offer meditation instruction. And there's different kinds of meditation. My meditation, you have your eyes open, sit, posture is very, very important, and the breathing, because you can relax, because then you can sit like 45 minutes without moving. Of course, if you're afraid, your knees might feel bad when you're trying to get up, but it's one way. Yoga meditation is a different way. Yoga especially has a mantra, the Reiki movement program. Have you ever heard of Sufis? Do you know what Sufis are? Sufis are Muslim, okay? But they're mystic. They're mystic Muslims, and they're part of the dancing of the whirling dervishes. So their meditation is a very quick movement, so that everything is out of their mind, and they're receptive to whatever comes. Not my kind of meditation, and obviously not what people in pain can do, but meditation itself is not like that. So there's meditation that uses a mantra, there's meditation that focuses on a picture, there's meditation that focuses on your breath, and they talk about emptying your mind. What you're really doing is coming back to the present and not thinking. And it's almost as if your brain were a muscle, and by exercising this, you can stay in the present more. Because in the past, you're regretting, you can't do that. The future, you can make some plans, but you can't control it. And that's where a lot of worry comes from. So keeping in the present is one of the things that is amazing for meditation. And as I said, I have found that it helps with mental and emotional pain, to bring people into the present, to bring people away from spinning out what might be bad. And as I said, the physical meditation, I pass it off as breathing exercises. I use terms.
So how many people do you often train? Do you often train 1-to-1, 1-to-1, or 1-to-many? So
I don't know what you mean by training.
I don't know, like...
Oh, you don't know how I visit. We visit people in their rooms, and it's a one-on-one visit. Okay, so it's not elaborate, nor is it formal, nor do I teach a class to people how to teach meditation. I should say here at the Cancer Center, they were interested in having a course on meditation, because people who are doing chemotherapy are sitting there for a long time. It would also help with people who do, dialysis, where your blood gets changed, your blood goes from you through a machine and gets cleaned.
Oh, yeah.
Okay, so people on kidney dialysis usually do it 3 times a week. So meditation might help with that also. Make it a timeless kind of situation. But we don't do that yet. We don't have enough people to it. So I can't. I mean, you're asking and raising some very interesting research issues, but it's not something that I know. Have you done a literature search?
No.
Okay. Try to do a literature search doing with medicine plus pain control, plus meditation. I think John Hopkins and Duke have probably done research on that. You might get quotes out of there.
He is a doctor.
Oh, sorry. John Hopkins is a university.
Oh.
Okay, and Duke is a university. Oh, you should know Duke. Watch that. Come on, girl.
Yeah.
Well,
Yeah.
Duke does a lot of interesting kind of research with mental influence on physical. Okay, that's what you're dealing with. John Hopkins has also. I don't have many other places, but I would suggest you do some kind of literature search. You might get some, good quotes for your thing. Now, as far as meditation and tattoo pain control, it's just meditation and pain control. I think you should talk to people in tattoo parlors.
Yeah, I think so.
Yeah, I think you might not want to go by yourself. You might want to. It's going to be quite barbarious sometimes, but I think you're going to find a difference. It also depends on where you get it done. My son does tattooing. Okay? So I said I wanted to have a tattoo. I said I thought it'd be nice to have a tattoo over my wrist. And he said, no, mother. He said, you don't want one. He said, it'd be too painful because your bone is right there. He said, you're going to have a tattoo. I said, well, I got a scar over here. Probably the body part of it. I haven't done it yet. I'm not afraid of pain myself. But you see how this would be a place where you could come. Maybe if you were anticipating taking chemotherapy or radiation, because it's fall into basically your whole system. Okay. Any other questions?
Yeah, like it is for free.
Free? Oh, absolutely, yeah.
So people from like
Did you come and sit here?
yeah, like,
Well, you would just have to get your ID. You can't get into the hospital without your ID. It's a safety thing because we have children in the hospital and we have people who are vulnerable. We have people who have been shot by someone and they might want to come in and finish it off. So you could, yeah, but you just the way you got in this last time, you have to have you should put your ID somewhere where they can see it. Don't worry about it. But yeah, if you want to come here, absolutely. Sometimes family will go and sit in the chapels while beginning or ending visiting the patients, or while there's an operation. This operation is taking a long time. A family can come and sit in here or sit there for meditation while their member is doing, other family member is doing the chemotherapy. Because people don't usually come by themselves to do chemotherapy unless they're sick. Somebody has to drive them and come with them. So this is open and people do use it, yes.
So there are two centers for patients to do meditation. The first one is this,
Here,
and the other
and
one
then
is
there's another chapel up on the 12th floor. I can show you that too.
do you mean that small room with
Again, another room.
sofa?
We have 3 rooms where people can go and do meditation or prayer. Yeah.
Okay, so what's the difference? Like, how could you use these 3 places?
Oh, well, this place is meditation only. We don't have any services in here. This is just open all the time. Okay. The one that we went into, we have services at noon every day, plus one at 4 o'clock on Saturday. And some of them are specific, like the Saturday evening one and the one at noon on Sunday and noon on Monday. Those are Catholic masses. At 10:30 on Sunday, that's the Protestant Christian service. On Tuesday, there's a prayer service. It's generally Christian, but it includes everybody. There's not a service on Wednesday. Thursday, the students do a service, so it's usually prayer or worship or singing or something. Friday is a Jewish one, because that's a Jewish Sabbath. For Muslims, there is always the place I showed you where you could pray, but there is also a Red Cross hospital, which we're connected with. I mean, physically connected. There is a Friday noon service. Okay? So we have all these various services. But this space is only for meditation. The chapel on the first floor is for worship services and prayer and meditation, open 7 days a week, 24 hours a day. This one is also. And then on the 12th floor, somebody sent an email. On the 12th floor is a very small ceiling. The 12th floor is on the floor where the children's hospital, the sickest children are, but the 11th and 12th floor are the children's hospital. But that's not just for the children, but there are chairs and for people, for little kids to go and stuff like that too. But it's mostly used by family members, because people are too sick to leave their rooms. If they're okay to leave their rooms, they're usually okay to, go someplace. Like they probably go home.
So you mean there is a center also for children to do meditation?
There is a hospital, and there's a chapel on the floor in the children's hospital. The top 2 floors of the tower, I can show you, are considered the children's hospital. The Amazon's children's hospital, even though it's physical part of it. And there is a chapel up there on the 12th floor, yes. So it's a lot of times you get some children up there. And mostly parents, they have very, very sick children. They're babies, they like horrible things, things are happening. So parents will go there, be quiet, have a quiet place. And it's right there near where the children are, so they don't have to go far.
So in this way, children have kind of space for them to meditate before the therapy.
You can say that. We don't train them to do that. They choose to do that, yes. But do not come to conclusions that I have said, okay? I know it would be nice to like, people go to meditate. But see, meditation isn't a big part of a lot of people's life. And, so it's not something. So that's why it's like, I don't say to people, okay, we're going to meditate. I say, here's some breathing. It's like, should we get some kind of control? But yes, children definitely could use it for that. If you're teaching meditation to children, you do it maybe for 5 minutes. Yeah, because to keep them still. But you do teach that. You can teach meditation to little kids. Little ones. They're very flexible. They sit there. They can do a full lotus like you would believe it. But yes, we just don't do it here. But I have to say, these are very sick children, so very few of them are rooms. There are some who, yes, they go to school. They're great ages. Did you want to see the other chapel?
Yeah.
Okay. Any more questions?
No.